Assalamualaikum warahmatullahi wabarakatuh and salam sejahtera. We are from Group 4 of Class AS11618 and for our Basic of Nutrition group assignment, we have agreed to choose the topic of diabetes. When someone talks about diabetes, what will you have in mind? It must be something to do with sugar, right? Did you know that in 2016, World Health Organization has estimates that diabetes was the 7th leading cause of death in the world? Isn't that terrifying? Diabetes is a condition where the levels of blood sugar are too high because the body cannot use it properly. This could be because the pancreas doesn't produce enough or any insulin, or our cells do not respond to insulin. What does this mean? Our body digests carbohydrates, breaking it down into glucose. Our liver also produces glucose. Insulin is a hormone produced by the pancreas that allows glucose to enter our body cells to produce energy to undergo our normal life process like growing and repairing. But if you have diabetes, your body cannot do a proper use of this glucose, and so it builds up in our blood and can't be used by cells there. There are two main types of diabetes. Type 1 is when there is no insulin produced at all, whereas type 2 is when there is insulin present, but either there are not enough or it isn't working properly. Type 1 diabetes is also known as an autoimmune response, where the body destroys its own insulin-making cells. The food that has converted into glucose cannot enter the cells, leading the cells to can't be used for energy because there is no insulin. Therefore, the body has to break down fats to use the energy, causing someone to lose their weight. Type 1 diabetes can appear at any age, and it also usually happens before the age of 40. Type 1 diabetes can also account for most cases of childhood diabetes. Did you know what are the symptoms of type 1 diabetes? When someone has type 1 diabetes, they will always feel thirsty, needing to regularly pass urine, tiredness, and weight loss, and this occur very suddenly. Type 1 diabetes has nothing to do with diet or lifestyle. Unfortunately, there is currently no cure for type 1 diabetes, just daily treatment on insulin injections or pumps and regularly blood sugar testing. So now I'm going to explain about type 2 diabetes. Type 2 diabetes happens when there is insulin present, but either there isn't enough or isn't working properly. Type 2 diabetes usually appears in people over the age of 40. But now, it has become more common in children and young people to have it too. Type 2 diabetes is the major diabetes as it accounts for between 85 and 95% of all diabetes. Different with type 1, the symptoms for the type 2 are much more mild, making it harder to detect. There are some key risk factors associated with type 2 diabetes, including increase of feeling thirsty, frequent urination, being overweight, not doing much or any physical activity at all, and all above. Due to all these risk factors, you may not be surprised to know that having a lifestyle changes could help us preventing ourselves from type 2 diabetes. As example, by having a healthy diet and try to stay away from unhealthy food such as fast food. Also, exercise for at least 30 minutes a day can reduce your risk of developing type 2 diabetes by 40%. By doing exercise and having a healthy diet, you can control your weight and get an ideal weight as your body mass index. So now we have learned about the difference between type 1 diabetes and type 2 diabetes. In conclusion, we should have a healthy lifestyle to prevent ourselves from this disease. Thank you and Assalamualaikum warahmatullahi wabarakatuh.